Imagine you're in the middle of an important meeting, a workout, or a simple family gathering, and suddenly, you feel that uncomfortable, involuntary leak. This is the reality for millions of people every day, dealing with urinary incontinence. It's more than just an inconvenience, it affects our sense of confidence and well-being. But here's the good news, you're not alone, and there are ways to manage it effectively. In this video, we'll explore urinary incontinence, what it is, why it happens, and how you can regain control and improve your quality of life. We'll cover everything from exercises and medical treatments to lifestyle adjustments that could make all the difference. So, let's dive in and tackle this problem head-on. What is urinary incontinence? Urinary incontinence is the involuntary leakage of urine, meaning a person urinates when they don't want to, due to loss or weakening of bladder control. It's common, about 1/4 to 1/3 of US adults experience it at some point. Surprisingly, it affects more women than men, with nearly 30% of women aged 30 to 60 affected, compared to 1.55% of men. There are several types of incontinence, and each has unique causes and triggers. Stress incontinence, leaks occur due to physical pressure from activities like coughing, sneezing, or lifting. Urge incontinence, also called overactive bladder, this is characterized by sudden, intense urges to urinate. Overflow incontinence, often related to an inability to fully empty the bladder, leading to dribbling or frequent small leaks. Functional incontinence, linked to physical or mental barriers, such as mobility issues, which prevent getting to the restroom in time. Total incontinence, the complete inability to hold any urine, often due to an underlying condition. Understanding the type you're experiencing is crucial for finding the right treatment. Why does urinary incontinence happen? For some, incontinence is due to temporary factors like a urinary tract infection, but for others, it's a chronic condition linked to various underlying issues. Here risk factors include age. Muscles that control the bladder naturally weaken with age. Gender. Women face higher risks, especially due to childbirth, menopause, and surgeries like hysterectomies. Weight. Extra body weight adds pressure on the bladder and surrounding muscles. Health conditions. Conditions like diabetes, kidney disease, and neurological disorders like stroke can increase the risk. Prostate issues in men. Conditions affecting the prostate, like enlargement or surgery, often lead to incontinence. Treatment options. Fortunately, there are many ways to manage and treat urinary incontinence, and treatments often depend on the type of incontinence and its severity. Here's a breakdown of some of the most effective methods. 1. Pelvic floor exercises, Kegels. These exercises help strengthen the muscles that control urination, which is essential for managing stress incontinence. Regular Kegel exercises involve tightening and relaxing the pelvic muscles, which you can do almost anywhere, anytime. 2. Bladder training. Delaying urination. Set a goal to gradually extend the time between bathroom trips. Double voiding. This involves urinating, waiting a few minutes, then trying to urinate again. Scheduled toileting. Set a routine schedule, say every 2 hours, to help retrain your bladder. 3. Medication. Medications like anticholinergics are often prescribed to calm overactive bladders, while others like imipramine can aid in controlling both bladder and mood. Topical estrogen, often recommended for postmenopausal women, can strengthen tissue in the vaginal and urethral areas. 4. Medical devices. For women, devices like urethral inserts or pessaries can help prevent leaks. Radiofrequency therapy. This technique heats tissue in the lower urinary tract to increase firmness and control. Botox injections. Botox can help control overactive bladder muscles, reducing urge incontinence. 5. Surgical options. Sling procedures. These involve placing a mesh under the bladder neck for added support. Colposuspension, a surgery that lifts the bladder neck to prevent stress incontinence. Artificial sphincters. These devices control urine flow for those who cannot maintain control with other methods. 6. Other options. Urinary catheters. These are helpful for those with significant leakage issues, providing a steady route for urine. Absorbent pads and protective garments, widely available, they provide a discreet and practical way to manage leaks. Managing daily life with urinary incontinence. Having incontinence doesn't mean giving up your daily routines. Here are some strategies to help you manage it effectively. Use a bladder diary, track your fluid intake, bathroom trips, and leakage incidents. This helps you understand patterns and identify potential triggers. Diet and lifestyle changes. Avoid bladder irritants like caffeine and alcohol. Maintaining a healthy weight can also relieve some of the pressure on your bladder. Stay active. Regular exercise, particularly activities that strengthen the pelvic floor muscles, can be very effective. Seek support. Don't hesitate to talk to healthcare providers about incontinence. They can help you find a treatment plan tailored to your needs. When to seek help. Urinary incontinence is often manageable and even reversible, but there's no need to face it alone. See a doctor if you're experiencing frequent leaks, discomfort, or if incontinence is disrupting your daily life. A healthcare provider can help identify the cause and recommend treatments that can make a meaningful difference. Conclusion. Urinary incontinence may be common, but it's far from untreatable. From exercises and medications to devices and surgeries, there are many options to explore, so you don't have to let incontinence control your life. Remember, it's about finding the right combination of strategies that work for you. Take control of your health, and regain the confidence and comfort you deserve.